The Globe reported last week that health insurers in Massachusetts will boost rates by more than 6% for small businesses and individuals in 2016, and that'll impact about 300,000 people. As a former professor, I was wondering what grade you would give to how the Affordable Care Act has worked for Massachusetts.
Oh, so it's a good question. So the way I see this is it's hard to disentangle the effects of the Affordable Care Act and a lot else that's going on in healthcare generally. And so we say costs are continuing to go up. You know, as a data nerd, I say look at what was happening to costs before we ever adopted the Affordable Care Act. So yeah, it's going up. It's not going up at the speed with which it was going up. And we're seeing a lot of support at the federal level because of the Affordable Care Act for things we pioneered in Massachusetts, like community health, which turns out to be both a lower cost and more effective way to deliver health care for everybody from our tiniest babies to our most senior citizens. And so in that sense, yeah, we worry about costs going up. Are we going to be able to get costs under control fast enough? I spend a lot of time and a lot of energy on this and talk a lot with a lot of folks in Washington about it and try to be helpful, try to work and be constructive on this. But I do want to add one more part for us in Massachusetts. Because if I were anywhere else in the country, I would be saying A++, because a whole lot more people are insured than were insured before, right? We've got literally millions and millions of people today who are covered by health insurance who didn't have health insurance before. Full stop. In fact, we should all just stop and say that is a good thing in this country. God bless. In Massachusetts, though, we were already getting most people covered. But here are the big differences that come in from the Affordable Care Act. The first one is, big part of Medicaid now gets picked up by the federal government, which turns out to relieve us some of burdens we had taken on by ourselves in Massachusetts. Very helpful to us. The laws have shifted so that young people up through the age of 26 can stay on their parents' plan. That's a good thing. No canceling insurance for pre-existing conditions. Seniors get one free health exam every year. The donut hole, remember, in prescription drugs, what is it, $940, right? In the donut hole is slowly being closed by the ACA, and we're going to have that bridged, and that will literally help tens of thousands of seniors here in the Commonwealth of Massachusetts. So my view on the Affordable Care Act in Massachusetts is that it also gets an A+ because it's added new pieces of protection. It has helped push down the costs of health care. It's the direction we want to go. Is it perfect yet? No, but I don't require that for an A. I say it heads us in the right direction. Ask some of my students.
Okay.
It heads us in the right direction, and it's provided protections we did not have before. I think it really works for us, and so I'm really happy to see it.
So A++ nationally and A++?
No, just an A+.
A+.
At the state level. Well, A++ really because of the difference it makes. It's like the difference between night and day. Here in Massachusetts, we were already living in the daylight. But it does make it better. And I'll tell you something. You want any little piece on this? Go visit some of the community health centers around this state. This is actually like one of my favorite things to do as senator here from the Commonwealth, is to go visit Codman, is to go visit Fenway, is to go visit these fabulous healthcare centers. And the thing is, every one of them is different from the other. This is not cookie cutter healthcare. They serve the populations that are in their proximity, that are in their area, and they do the work that needs to be done. I've been to healthcare centers that are doing outreach, that are in the public high schools providing information about sexually transmitted diseases and birth control and things the kids need to know about, and they do that as part of the health centers. And all of this, the idea started in a good place here in Massachusetts, but ACA has helped really roll it along.